This episode is brought to you by Progressive. Are you thinking more about how to tighten up your budget these days? Drivers who switch to Progressive save over $700 on average, and customers can qualify for an average of 6 discounts when they sign up. A little off your rate each month goes a long way. Get a quote today at Progressive.com. Progressive Casualty Insurance Company and Affiliates. National annual average insurance savings by new customers surveyed in 2020. Potential savings will vary. Discounts vary and are not available in all states and situations. I was a little hesitant to speak with Dr. Bernard Ashby. Dr. Ashby works in Florida, takes care of COVID patients. He's bearing witness to that state's record-breaking surge of infections at the moment. It's not that I didn't think Dr. Ashby would have interesting things to say. It's just, how many times can you repeat the exact same thing? Wear a mask indoors, get vaccinated, support healthcare workers. But when we get on the phone, Dr. Ashby sounded just as frustrated as I am.
The transmission rate is ridiculous down here.
Yeah, how are you seeing it?
So I'm seeing it in my office, seeing it in the hospital. Patients are coming in by the boatloads. They're younger, they're sicker. And unfortunately, we weren't really prepared for the surge that we've gotten, but we were never prepared.
I wanted to know who a frontline physician would hold accountable for this COVID spike. A dark rerun, complete with the same overcrowded hospitals and regretful patients we've seen before. Watching the news, it feels easy to find a villain. Republican Governor Ron DeSantis.
South of the border, COVID-19 numbers are surging in Florida. Yesterday, the state reported its highest daily case count since the pandemic started, and some are blaming the governor.
Florida Governor Ron DeSantis blamed the media.
You try to fearmonger, you try to do this stuff. And when they'll talk about hospitalizations, our hospitals are open for business.
They are, but they're strained.
But Dr. Ashby says the blame game misses something.
Everyone's playing politics with this. It's not just the Republicans. It's the Democrats, too. And there's a lot of different agendas at play.
Dr. Ashby looks at what's happening in his home state as an awful but inevitable collision between an amoral virus and public health messaging gone wrong.
At some point, we're all going to be exposed to this virus. The question is whether or not you're going to do it as someone who is immune or someone who is immune naive. And that's kind of how I thought we should have framed it. But instead, they made it sound like, the vaccination would be some kind of force field that will protect you from the virus. And now that we're seeing how vaccines actually work in the real world, a lot of the public health authorities are having to backtrack and kind of explain the things that they should have been saying from the very get-go.
Who do you blame for that?
Oh, man, I blame everybody. Yeah. Newsflash, coronavirus ain't going nowhere. The Rona ain't going nowhere. It's going to be here for the rest of our lives.
Today on the show, inside Florida's surge. We may have to live with this virus, but we don't have to live like this. I'm Mary Harris. You're listening to What Next? Stick around. This episode is sponsored by Talkspace. The world is racing to get back to normal and start meeting up in person again. But after the year we have all had, getting back to feeling normal takes time. If you are feeling overwhelmed by it all, you are not alone. It's important to find the support you need to face those feelings and move forward. When you're in a low point, you might feel like you're on your own, but over 50% of Americans struggle with their mental health. Whether you're a parent, student, millennial, or just someone having a hard day, Talkspace can provide the support to help you feel better with a single message. Talkspace offers individual and couples therapy, in addition to medication prescription services. Set goals with your therapist, and they can help you make sure you're really progressing. Talkspace therapists help you develop tools to cope in difficult times. And it works around your schedule at your convenience. Schedule live video sessions with your licensed therapist from anywhere. Start feeling better with a single message. Match with a licensed therapist when you go to Talkspace.com and get $100 off your first month with the promo code WhatNext. That's $100 off when you use the code WhatNext at Talkspace.com. Take me inside a hospital you work at in Florida right now. Like, what's it like?
I'm a cardiologist, first of all, but what I emphasize to people is that before I was a cardiologist, I've always been a general doctor. And so at the hospital, in addition to consulting cardiology patients, I also take care of general patients as well. And so I do take care of patients that come through the ER with COVID-19 who are very ill. And in that capacity, what you're seeing is just, a lot of sad stories. I mean, patients tend to be less educated. They tend to be, the working class. There's a large migrant community, many of which are undocumented, who are coming in. And it's unfortunate. And what you see is when they come in, they're sick, they're scared, they know about the horror stories about COVID-19, and they're just wondering if they're going to meet that same demise. And when you see someone who has an O2 sat of less than 80%, and they're breathing heavy, and sometimes they're sweating, it's a sad sight. You could really feel the fear coming from them.
When you tell a patient they have COVID, I'm curious how they respond. Like, is the response, "Oh no, I thought it was this," or "I meant to get vaccinated, I just didn't make the time"? Like, what are you hearing from them as you talk about their illness?
It's interesting. I have yet to encounter a patient that was surprised by the diagnosis. They usually know coming in the door that they have COVID-19. People are listening. They hear the stories. They've probably had a friend or know someone that has had it. And so they know what COVID entails. And so they're not surprised. So they get the diagnosis. The patients that I'm seeing now, a large portion of them, really all of the patients that I've seen have been unvaccinated. And if they have a chance to talk about it, I hear a different story, probably not every time, but, there's certain themes, but, everyone has a different story.
Yeah, tell me a couple stories.
I had one patient, she came in with COVID-19 and she was unvaccinated. And I asked her, why? Why didn't you get vaccinated? And this was after she kind of made it out and wasn't, tenuous. And she basically said that she had some concerns, but she just didn't really have the time or the opportunity to get it. And she was someone that was working in the fields, basically harvesting crops.
A migrant worker.
Exactly. And she wasn't opposed to getting the vaccine. It's just that, no one really talked to her. No one presented the vaccine to her. And she clearly would have gotten the vaccine if she was targeted. And so that's an example of, how we could, do better at our public health campaign and address these populations that are largely forgotten.
It's interesting to hear you talk because, I looked at the vaccination rate for the state. It seems like Floridians are about half vaccinated, which is sort of the median. Like it's right in the middle for the states, which isn't great, but it is what it is. And I see so much focus on the vaccine resistant, but it sounds like you're also seeing people who just haven't been reached. I think some folks may have the perspective of, oh, you can just go to your Walgreens and get it. Like, it's so easy. It's free. What are you seeing that you would say to people like that who would say, well, isn't it available to everyone?
this is indicative of our healthcare system as a whole. I mean, vaccination rates have always been low in certain demographics prior to the pandemic. Access to care has always been an issue in certain demographics prior to the pandemic. And we talk a lot about disparities, and I actually dislike those terms, disparities and inequality, all that yada yada, because it makes it sound...
Is it the passive voice you don't like?
Yeah, it makes it sound like it's an abstract thing. I mean, I see it every day, you know what I mean? So I see that patients can't afford insurance. A lot of people are uninsured. A lot of individuals are uninsured, particularly if you have Medicaid, and they get inferior care. So these patients don't get treated well. Things get overlooked.
In some ways, you're saying like it makes sense that this would be the population that would be unvaccinated.
Yes. These people are not engaged in the first place. And it's interesting that a lot of people are surprised by like their hesitancy. I mean, we didn't care about them before, and all of a sudden we care about them in the context of the vaccine. And I think, this is kind of a wake-up call, and this should lead to a fundamental reckoning of the failures of our healthcare system. I mean, we're one of the worst, if not the worst, performing countries in the industrialized world. And that's precisely because we've decided that healthcare is a privilege and not a right. And you can see that in how we approach the pandemic and how we approach the treatment of patients. In fact, there's been tons of data, even a recent study that came out of UPenn that showed that your mortality rate from COVID-19 was directly tied to what hospital you went to. And you know what hospitals had the highest mortality rate? Well, the county hospitals, the one in urban areas.
The ones that serve Black and brown communities.
Yes, but also rural communities as well. Poor white people. No, they get the crappy care as well. And we're not talking about that at all. We're acting like these issues don't exist, and we're just focusing on vaccination. You can't just focus on one thing. You have to take a step back and look at the big picture, because we are failing large demographics of Americans. And, a healthy America is a strong America, and we're really forgetting that. And as a result, we're seeing a large portion of our population die unnecessarily from preventable illnesses. And now just add COVID-19 to the equation, and you got your stew. And so it's unfortunate.
Can we talk about you and your colleagues? Like I heard an emergency physician in Miami quoted basically saying staffing is a huge issue, because after a year and a half of treating patients with COVID, everyone was surprised by what's happened now. So how are you seeing that in your hospital? Like, what's the conversation like in the break room?
You're going to get me in trouble. But people are angry. I mean, people are tired. People are stressed. I mean, we're just seeing different parties at play. And yes, staff is an issue. But Florida, compared to other states, we have a relatively good nurse-to-patient ratio. And I think that is one of the main reasons why we had a lower case fatality rate, meaning when people actually get sick and get hospitalized, their chances of dying were lower than most of the country. And that's
because they got higher touch care.
Exactly. So that's something that, was a good thing. However, people are tired, people are burned out, and we need to address the mental health implications of this. I mean, the entire world has had collective PTSD from this pandemic, but particularly the frontline workers, particularly individuals like nurses, like respiratory therapists, like phlebotomists. These people are in these patients' rooms. They hear them coughing. They know they're sick. And so they're much more likely to encounter the virus, but they're much more likely to experience the pain and the suffering that these patients are going through. And I just don't think they get enough credit, enough appreciation. And frankly, I don't think they get paid enough. So, I think we need to focus on that.
When we come back, why Dr. Ashby and his fellow physicians are going head-to-head with their governor, Ron DeSantis. Support for this podcast comes from TD Ameritrade. There is no ROI on TMI. That's why TD Ameritrade created a learning experience that will actually learn with you. Curated from their vast library of exclusive content, it customizes to fit your investing goals, interests, and needs. So you get exactly the information you need and none of the information you don't. Get started at tdameritrade.com/education. That's tdameritrade.com/education. What Next is supported by Wise, the smart new way to move money internationally. Imagine a world without borders, a world where your nationality would never limit you, where you could speak any language, travel to any place, and spend in any currency with ease. At Wise, they love the sound of that world, and they're building the money part. Wise is the world's most international account. It lets you hold and convert dozens of currencies, all in one place. And you always get the real exchange rate, with no markups like the banks sometimes give you. So wherever you go, or wherever you need your money to go, you're ready. That means that whether you're sending money to Australia, hopping on a plane to Poland, or getting paid from France, Wise is all you need. Wise is your passport to borderless money, designed by international people for international people. Join over 10 million people and businesses and try Wise for free at wise.com/whatnext. Dr. Bernard Ashby thinks about how public health officials use their voices pretty carefully. For instance, when we talked about vaccine mandates, he said he wasn't really a fan. He worries the people least likely to have access to a vaccine would end up being punished for a systemic problem. But that doesn't mean he agrees with Florida's hands-off approach to the pandemic. In the last few weeks, in between seeing patients, Dr. Ashby has been popping up on CNN and MSNBC to speak out against Governor Ron DeSantis' lack of coordination when it comes to this latest surge. He wants the governor to be more proactive, less reactive.
So what can I say about our governor? I got to laugh from crying because it's so reckless. So about 2 weeks ago, a little bit over 2 weeks ago, myself and some other colleagues actually did a press conference because we saw everything surging. And we were like, hey, what's the plan? Let's do something here. Like, hospitals are filling up, people are getting sick. What are we doing? And we expressed our concerns. We wanted some action. And, we laid out some specific things. But in general, our message was, let's be proactive here. And instead of that being met with some positive response, I should say, the governor just got all political on us. I mean, they released a statement saying that we don't know what we're talking about. One, he gave a press conference that alluded to us saying that, these physicians basically want lockdowns and mandates, and he's opposed to all of those.
Well, look, so if anyone is calling for lockdowns, you're not getting that done in Florida. I'm going to protect people's livelihoods, but to have the government come in and lock anyone down or restrict anybody is totally unacceptable. And it's easy for some physician to advocate that because it doesn't affect them. It does affect the people in this state. So we're going to lift people up. We're not locking people down, and we're going to make sure.
Is that what you want?
No, I mean, we never said any of that. We didn't even talk about mandates, even though I do think mandates are a great tool, a great idea. Like, we need masks, of course, but I didn't talk about any of that. I just said we need to do something.
Did you ask to meet with him?
Did I ask to meet with him? No, that I didn't ask specifically, hey, let's sit down. But now that you mention it, I think I will. And hopefully he'll listen to me. But I've never done that. We were just kind of advocating for our patients, just saying, hey, like, leaders, we need to, light a fire, under you guys. We need to get something done. But Ron DeSantis was basically making straw man arguments. I mean, he was basically doubling down on his freedom, kind of stance that, He doesn't want government to dictate what to do for folks.
What did you want?
We wanted proactive measures. So we wanted this to be made an emergency situation. So we wanted him to reinstate the emergency order that was in place, not necessarily the same measures, but the emergency order, so that we can be on high alert and start distributing and allocating resources appropriately. But in addition to that, we wanted masks to be used. Obviously, that's very important. And this predated the CDC recommendations. But DeSantis just didn't do anything. He just talked about politics and made fun of masks and Fauci and whatnot, and just did nothing. Was traveling to other states and basically fundraising for his campaign. Basically not taking it seriously.
And then Governor DeSantis did start to act, but not in the way Dr. Ashby would have recommended. DeSantis started out by issuing an executive order limiting the use of masks in schools.
I have young kids. My wife and I are not going to do the mask with the kids. We never have. I want to see my kids smiling. I want them having fun.
The governor might say, I'm not against masks. I'm against mandates.
Yeah, but you can't speak out of both sides of your mouth, because he'll say he's not against masks, but he's selling campaign merchandise saying, how am I supposed to drink with my mask on? Making fun of masks. You have him saying that masks are detrimental to kids.
President Biden seemed to agree with Dr. Ashby. Last week, he took aim at Governor DeSantis and his counterpart in Texas, Greg Abbott, that issued similar bans on mask mandates.
I say to these governors, please help. But if you aren't going to help, at least get out of the way of the people who are trying to do the right thing.
But this seemed to play right into DeSantis's hands.
And Joe Biden suggests that if you don't do lockdown policies, then you should, quote, get out of the way. But let me tell you this. If you're coming after the rights of parents in Florida, I'm standing in your way. I'm not going to let you get away with it.
The governor managed to neatly pivot from COVID to another hot-button issue.
So why don't you do your job? Why don't you get this border secure? And until you do that, I don't want to hear a blip about COVID from you. Thank you.
Do you ever talk politics with your patients?
Oh, my goodness, yes. A lot of them see me on TV, and my patients love me, man. And, I have very different demographics. I have in Miami, largely Black and Latino, in the Treasure Coast, largely white, rural folks. And, I have some diehard Trumplicans who are my patients.
Talking about Florida right now, I'm really reminded of this conversation I had with a reporter in South Dakota a month or two ago. We were talking with the governor there, similar to DeSantis, didn't want to put in mask mandates and has been really trying to pump herself up nationally because of her stance. And what he said was, from the outside, it might look like South Dakota doesn't have the best COVID response. But if you're in South Dakota, people really like this freedom that the governor's given them. Mm-hmm. And I wonder, when you talk to your patients, whether you can see that there's this perception, even if the COVID numbers are going up, that the government's doing a good job, or whether it's different in Florida.
Yeah, what's interesting, and this is anecdotal, so you got to, take it with a grain of salt, I guess. It really depends on how old they are and how they assess their risk. And so my older patients who are vulnerable, oh my gosh, they think DeSantis is reckless. But my younger patients, particularly my white male patients, that are, super, that meet that demographic, they don't want to wear the mask. They're not getting vaccinated, and they love what DeSantis is doing, for sure. But my older patients, they do think that he's acting reckless, and they are very concerned because they know the mortality rate is so high in a demographic. They've known people or themselves might have had COVID and seen people die from it. And so their risk assessment is different.
What would you tell your patients in Florida right now who are hearing the news about this surge and maybe feel a little bit helpless?
So I would tell them that we are experiencing a crisis now, but you're not helpless. There are things that you can do as an individual to protect yourselves and protect your community. We know that masks work. We know that avoiding indoor spaces is important. Being outside is a better idea because it's safer. I do understand that it's hot, but just keep that in mind. Get vaccinated. That's extremely important. In terms of the public health message to our leaders, we can do things like focus on providing early aggressive care for people that do get sick. Or we're underutilizing the monoclonal antibody therapy. The government has already paid for that, and we're not giving it to people anywhere near the rates that we should be. And so that's a message for our leaders and for the public. Know that this therapy exists, and if you get it early, you'll do very well. Donald Trump got that therapy, and that's a big reason why he did well. And so, we just need to be proactive, work together as a community, and not be so ideological about things. We're all Americans, we're all Floridians, and we just need to realize that because the sooner that we do realize that, the better we can move on with our life. Because again, the coronavirus isn't going anywhere. There will be flare-ups in the future, and it really is incumbent on us to work collectively to protect our entire community, particularly the most vulnerable amongst us.
Dr. Ashby, thank you so much for making the time. I really appreciated this conversation.
My pleasure. Thanks for having me.
Dr. Bernard Ashby is a vascular cardiologist in Miami. He's also the Florida director of the Committee to Protect Healthcare. And that's our show. What Next is produced by Elena Schwartz, Carmel Delshad, Davis Land, Daniel Hewitt, and Mary Wilson. We get a little help each and every day from Allison Benedict and Alicia Montgomery. And I'm Mary Harris. I will catch you back in this feed tomorrow.